Good morning, and thank you very much for joining us. I'm Howard Dean, moderating this discussion. We're talking this morning about a critical issue of vaccines. Over the past several years, we've seen an increased politicization of vaccines, which has raised anxiety and uncertainty. Just yesterday, the Partnership to Fight Infectious Disease released the new findings from recent polling that showed a general favorability towards healthcare broadly and vaccines specifically. The polling found optimism in future vaccines, the role of vaccine as a preventable health measure, and shared concern about the U.S. maintaining a leadership role in the development of vaccines and medicines. The findings did, however, identify concerns around lack of trust, which many might point to as a reason why routine vaccinations have been in decline, and a resurgence of concerning and highly contagious conditions like measles. The bipartisan poll conducted by Lake Research Partners and the Terrence Group examined a wide range of vaccine-related subjects, including perceptions of safety and efficacy, acceptance of current and potential future vaccines, and varying levels of trust in the messengers disseminating vaccines. I am extremely pleased to introduce you to two of the leading pollsters on this project, who will share more details. David Merman is a pollster and a political strategist for over 20 years and a partner at Lake Research Partners and heads the firm's Bay Area office in Berkeley, California. He advises incumbents and challengers at all levels of the electoral process, as well as a wide range of advocacy organizations, independent expenditures, foundations, and so forth. Brian Nienaber is a vice president at the Terrence Group, one of the most respected and successful Republican research and strategy firms in American politics today. Brian has taken the lead in development, fielding, and analysis of research projects for political campaigns at all levels, as well as for ballot initiatives. So, David, why don't we turn this over to you to open this up. And then after we hear from Brian, we'll then go on and talk to some of the physicians on the panel. So thank you so much and thanks to the audience for participating.
My pleasure. Thank you, Governor Dean. Appreciate the introduction, and great to be here with all this distinguished experts. And we'll turn to the real experts shortly. But what Brian and I have to share are some findings from this recent research that was just noted. This is a national survey of registered voters, and there's a lot of data there. I'm not going to go through all of it. I'm going to give you an overview of what we learned. There is a more extensive version of that reporting with some of the data and graphs, which can be distributed to folks after this. But I'll give the highlights, and Brian will also add his perspective after a few minutes there. So let me put this on the screen, and this is again bipartisan survey we conducted just last month, and we were looking at registered voters nationwide and interested in. We conducted this a few months ago now, and looking at their attitudes toward vaccines, current vaccines, their own behavior and perceptions around vaccines, and also looking to the future and what their reaction would be to upcoming potential vaccines for additional diseases. And as noted, there were some positive and hopeful findings about the level of support for vaccination in general, particularly for the most commonly known childhood diseases, a lot of support for and interest in future vaccines, but also some concerns and some problems regarding trust, and there's certainly some misinformation now that is widely shared by many people in the electorate, and unfortunately there's a fairly strong partisan pattern to those findings, which Brian will mention as well. So looking here at the data, first of all, just note this is commissioned by this Partnership to Fight Infectious Disease, conducted in January, covered this range of subjects, and reliable sample to cover the full range of the country and break down that data. There's lots of demographic analysis in the full report. And I would also note we did some focus groups and qualitative research leading up to this to help understand sort of the right questions to ask and how to frame those questions, understand sort of the perceptions that are going on in people's own minds and communities about vaccines currently. And of course, all of this is happening in the wake of the COVID-19 pandemic and a lot of the divisions and misinformation that have arisen through that as people went through that experience. And that's certainly relevant to what we found in this research. So this is just the specs of the methodology, 1,000 registered voters nationwide, conducted in late January, and the margin of error on these numbers is plus or minus 3%. Demographically representative sample of registered voters, closely divided politically, which turns out to be quite relevant, and notable that most of these folks have a doctor, most of them are vaccinated themselves, but there are plenty of folks also who have issues with health access or access to vaccines, which we also touched on in the research. We would say, as an overview, that voters generally have a favorable view of vaccines as well as doctors and medicine. It's not a complete about face where people are suddenly completely mistrustful of everything. That's not the case. They are, in fact, favorable toward vaccines in general. But we also found a real divide growing within the public on their perceptions of vaccine safety and their specific acceptance of all vaccines. And as noted, unfortunately, this divide falls fairly strongly along partisan lines. It was the single biggest predictor, if you will, in the demographics, where Republican voters, if they are Republicans, having more skeptical views and being somewhat less likely to accept the current and future vaccines than Democrats, and independent voters being somewhere in between. More trusting and more accepting of vaccines than Republicans, but less so than Democrats. We did find, however, that voters across demographics, and this was interesting, we didn't see the same partisan pattern here. They are interested in new vaccines and believe it is important for the US to remain a global leader in vaccine development. And that is promising in terms of how to frame and communicate about the need for and the potential of new vaccines. The concerns or the doubts that we noticed in the research seem to have to do mainly with perceptions of safety. And while voters tend to believe that FDA-approved vaccines are at least somewhat safe, it's only about a third who are confident that they are very safe. So that level of doubt is, again, it's a minority that are actually truly skeptical, but there is a somewhat larger group that at least has some doubt in their mind. Is it really true that if a vaccine is approved by the FDA, that it is truly safe? Only about a third are really fully confident, and then it's a larger majority who are at least somewhat confident. Voters do tend to think that vaccines are beneficial, but they are, interestingly, when we use the word beneficial, they're much more likely to say they're very beneficial than they are to say that they're very safe. So the doubts come in more about safety than they are about effectiveness or benefit. Still, a majority of voters believe in the safety and the efficacy of all the common existing vaccines that we tested, and that includes COVID-19. COVID-19 is a bit of an outlier in the sense that it is a higher share of voters that think it's ineffective and or risky relative to the other vaccines. So COVID-19 is more controversial in that sense, but it's just a matter of degree. It is still a majority that actually think that COVID-19 is both safe and effective, the vaccine. We also found a gender gap, and the gender gap had to do with the trust in medicines. The trust in vaccines rather than medicines. So both men and women were more trusting of FDA in terms of FDA-approved medicines. When it came to vaccines, women were more trusting than men of FDA-approved vaccines. And that's related to partisanship, but it wasn't fully explained by partisanship. It is, however, true that the profile of a voter who is more likely to be somewhat skeptical of medicines as well as vaccines is a white Republican man, and more likely to be skeptical if they're non-college educated, and more likely to be skeptical if they are rural. And those patterns, again, are consistent with partisanship, but we found throughout the data. Having said that, in terms of their own behavior, most voters do report, more than 3/4, they do get the vaccines that are recommended by their doctor, that they tend to get those vaccines at either their doctor's office or at a pharmacy. We did find that expanding availability at regular doctor's visits had some promise for bringing in people who might not otherwise get them. Like, yes, I would be more likely, it'd be more convenient if I could get my vaccines at my doctor's office. And they weren't clear in all cases that they could do that or that they had access to that. But if they did, they'd be more likely to get the vaccines. People are a little bit less likely to say that they would get vaccines for themselves than they are for their children. So if they are a parent of young children, they're more likely to say they're vaccinating their children than to vaccinate themselves. And that lesser degree of willingness to get vaccines for themselves is largely among Republicans. And Democrats and independents are slightly more likely to get vaccinated themselves as well as to vaccinate their children. Those partisan differences, though, are a little bit less pronounced when we're talking about their children than it is for themselves. So the adults for themselves, Republicans particularly more skeptical. For children, Republicans a little more skeptical, but not the gap is not as wide when we're talking about children getting vaccinated. And the types of vaccines, the particular diseases that people are most trusting of when it comes to vaccines tend to be the most common childhood vaccines, particularly the ones that people recognize. And we found this in the focus groups from their own childhoods. Oh, yes, I got all of those and I know that they work and I'm more confident in those childhood vaccines. The reasons people give for getting a vaccine for themselves is to protect themselves. That is their first and foremost reason or value for wanting to get a vaccine for themselves. And secondarily, but very close to that, rated very highly, protecting their families or others they care about. And it is notable that people are more interested in protecting themselves and their families than they are protecting more broadly the society or the community. They still, a majority say that's also a good reason to protect the community, but that is a less compelling reason, less motivating reason than protecting themselves and their families. So just to know that in terms of people's perceptions. And the reason that they give for not wanting a vaccine, the reason they might not get vaccinated, is a level of concern about serious and long-term health impacts. And again, we know there's a lot of misinformation, that a lot of things people believe here are concerned about. They're not necessarily true, but they do have that concern. And it is the substantial number of people, the reason they're saying I may not get vaccinated is because I'm concerned about those long-term health impacts. The thing they want to know first and foremost, is a new vaccine safe? And they tend to say that those who are skeptical tend to say, I want to wait and see for myself if it is safe before I'd be willing to get it. Having said that, when we posed forced choice statements, say, do you believe this or believe that? Should we get vaccines? Here's why. Should we not get them or be skeptical of them? Here's why. When we have those head-to-head statements, the pro-vaccine statements do win. More voters are choosing those pro-vaccine statements across the board. That's particularly true among Democrats. They overwhelmingly agree with those pro-vaccine statements. The anti-vaccine arguments are more competitive among Republicans, so the Republicans tend to divide more on these head-to-head choices. But it is still a majority across the board that are saying they support the reasons to get vaccines and to support vaccination for everyone. And they believe that they should be required for children to attend school. They believe that vaccines reduce the risk of serious illness and are worth getting, even if some people get a milder version of it. And that people, even healthy people, should get recommended vaccines to avoid spreading infections to more vulnerable people in their communities. Again, majority agreeing with those pro-vaccine beliefs, even when they're up against a counter argument arguing against them. And then finally, to summarize here, in terms of communication and messaging, voters do strongly agree that vaccines protect communities from dangerous outbreaks of disease, and that more widespread vaccination means more immunity and better community safety, and that healthy people should get vaccines in order to protect others in their communities. These are large majorities who agree with these, but to the extent that there are skeptics or people who disagree, who aren't certain that they agree, they tend to be, as noted, Republican, older men, non-college educated, who are more skeptical of all of those statements. They tend to support and most trust their own doctors as the most effective messengers on vaccines. And of course, we're going to hear from some medical professionals in just a minute here about that. But their own doctor rates a little higher in people's levels of trust than some of the more institutional actors here, such as the CDC, disease-specific organizations, doctors and scientists. Those also have moderately high levels of trust, but not quite as high as the patient's own doctors. So just noting that in terms of the rank order of who people trust the most. Let me stop there and bring in Brian for any additional perspective on these findings.
Oh, sure, David. Let me just take like a minute or two and kind of go over specifically GOP attitudes. You and I have a good fortune to work a lot of times on these bipartisan things where everyone kind of has similar attitudes when we're testing sort of public good or solid public policy. And this one, we just saw a little difference, I think, in GOP attitudes. I think very much driven by, the sort of Trump, wing of the party that now views sort of Fauci and the government is kind of out to get them. We talked a lot about white, rural, non-college educated people being kind of the linchpin of skepticism about this, and those are also very much voters who are a huge part of the Trump coalition. And I think we talked a little bit about personal decision being more emphasis Republicans. That's very much kind of I think a remnant of the debate of COVID and what states should require and they shouldn't. So I think just as we look at this, it certainly does mean I think we look at Republicans, they're going to need probably different or more unique messages because they aren't just going to go along with saying, well, the FDA says this is a good idea, and therefore I'm going to just accept this hook, line, and sinker. I think the positive is, as we sort of mentioned, it doesn't fully extend to parents deciding not to do this with their children. So we're still kind of seeing people willing to make their own decisions, even if this may be a little risky, but not willing to impose it on their children. And we talked, I think we'll have a little bit later on, there's still really strong support, particularly among Republicans, about the U.S. remaining a leader on vaccines. I think you can sort of have these patriotic rally around the flag and, national security importance of having these vaccines be important is a message that seemed to really resonate well with Republicans. And, there certainly might be a case where sometimes you kind of have to use different messages with different groups that kind of more national security focused, more, protect the country from threats might be a better message for Republicans than just a sort of validator message from medical experts. But that was really the key points I wanted to make. I know we've got a lot of other exciting things to go over, so let me just turn things back over.
Well, thank you both very, very much. This has that's a great kickoff. We fortunately are fortunate to have a number of expert physicians who are now going to be put in the frying pan here. The first is Dr. Melissa Briggs-Hagan from the CDC, Immunization Services Division. She has been with the CDC for more than 12 years, focusing initially on malaria and TB, and then spent several years in Africa leading programs for HIV care and treatment before returning to the United States and taking a lead role in the coronavirus and other respiratory disease division. Dr. Briggs-Hagan received her undergraduate degree from Princeton and then went to the University of Pennsylvania for her medical degree and Johns Hopkins Bloomberg School of Public Health for a master's degree. Dr. Angela Branch is an associate professor of medicine at the University of Rochester. She received her Bachelor of Arts degree at the University of Pennsylvania, doctorate in medicine at American University in the Caribbean. She completed residency in internal medicine at NYU Langone Hospital in Brooklyn, and followed with an infectious disease fellowship at the University of Rochester. Her focus is in research involves the use of viral, molecular, and immunological diagnostic assays to explore the pathogenesis and host response to acute viral respiratory illnesses in adults. She's currently co-principal investigator for the UR vaccine treatment and evaluation, one of 10 NIH-funded network sites in the United States. She is a member of the Infectious Disease and the NIH IDCRC Emerging Infections Expert Working Group. Dr. James Bigham is here with us as a representative of the American Academy of Family Physicians. He attended University of Wisconsin School of Medicine and Public Health, where he received his MD. Following graduation, he enrolled in the UW Masters of Public Health program to focus on global health. His interest was piqued his first year of medical school when he went on the first of 7 trips to Kenya to work in the Nairobi slums with women and children affected by HIV/AIDS. Returning year after year, he witnessed the very powerful and unfortunate link between socioeconomic status and wellness. And during this time, he also learned the importance of creating authentic partnerships with the patients. and the important role of the physician in assisting patients to take responsibility for their personal health. Robin Strongen is from the National Consumers League, is an accomplished public affairs expert with decades of experience working in Washington. She has worked for federal and state government, regulatory agencies, the White House, Congress, think tanks, nonprofit organizations, and every other group you could possibly think of, and there's a long list of them. Robin has served as presidential management intern and worked in the Office of Legislation and Policy in the Healthcare Financing Administration, now Centers for Medicare and Medicaid Services, known from now on by junkies like me as CMMS, the Prospective Payment Assessment Commission. In addition to serving in the office of Congressman Jim Florio, Robin spent a decade as a senior research associate at George Washington University's National Health Policy Forum. I'd like to sort of kick this portion of it off with any reactions to you may have about the polling, but I'm also interested in both specific and general terms. Do you think, first of all, we should focus more on details of specific recommended vaccines to address vaccine hesitancy, or is a broad discussion more helpful? Where do you see the disconnects relating to vaccine confidence causing challenges? What's really at stake when it comes to declining vaccination rates, and what are the impacts at the state and local level? So let's dig a little bit deeper with this, but let me get people's initial reactions. I'm going to be a little tough on the time because we have a huge program, and I have about 5 more questions. So let's get that started, and we'll start with Dr. Briggs Hagan.
Sure. Thank you, Governor Dean, and thanks to the partnership for setting up this session today. It's such an important topic, and I'm happy to be joining on behalf of CDC. I think a lot of what was presented resonated. We have a what's called the National Immunization Survey at CDC that has slightly different questions that we pull on, but we similarly see that there is a lot of support for vaccines and a lot of support for doctors being a trusted messenger, but lots of challenges, especially with more recent vaccines. And so I think nothing that was presented today was a surprise, but I think there are definitely some positive things that we can draw from. And as Mr. Nienaber mentioned as well, the idea that we need to focus our messaging, I think, is not new. It is likely that different audiences have different reasons for having questions about vaccines, and working with communities, working at a local level to understand what those reasons are is really an important part of public health. We really can't have a one-size-fits-all message. Maybe I'll start there. There's a lot of other questions that you asked. I don't know if you want me to cover any of those yet, but I'll start there with the high-level response.
Great. Anybody else want to chime in? Because I do have lots more questions if you don't.
Yeah, I think on a high level, I think the 2 things that kind of stuck out to me the most is, one, the concerns around safety. I think in that sense, that might be something where we could have just a general conversation about vaccines and not necessarily digging down to specific vaccines. You know, why is there so much concern about safety? How do we do in terms of messaging what the risks versus benefits of these vaccines are? And is there work that we can do in that space so that people feel that we are being open and transparent about what we think these vaccines are going to do, how they work, and what we know about their safety and what we have yet to learn. And so it troubles me that that's what drives a lot of the misinformation and a lot of the hesitancy around being vaccinated, because that's something that's easier to rectify than some of these other things, right? It's really just about messaging. And then the other thing that really struck me is the idea that patients will trust their physicians more than anyone else. This is why children are more likely to be vaccinated than adults, because those vaccines are being administered in the offices and in the clinics, whereas adult vaccines a lot of times are not being administered by the patient's own physicians. And so what is there on sort of a national policy level we can do to make it easier for patients to get vaccinated by the people they trust, and to have the conversations they need to have so that they do feel reassured. And so those are sort of the two large issues that struck out to me.
Dr. Branch, oh, sorry, go ahead.
Oh, I was just going to piggyback off of what Dr. Branch said. So I'm a family physician. I spend my time actually managing a panel of patients in Madison, Wisconsin, and trust is the word, I think. So really what this comes down to is about interpersonal connections people have. You know, we actually know that data doesn't sway people the same way that a connection does in a relationship, and even someone's own identity. So if I give you facts and you have a understanding of who you are in your mind, and it's at odds with how you identify, you're going to choose your personal identity over facts. We're seeing that. And so it actually takes a connection. And so I do think we have some system level things to work on as far as how we deliver vaccines to ensure that the most trusted messengers are at the forefront, and that we create time and space and resource to ensure that we're doing some of this really foundational work on vaccine delivery.
Is it okay if I jump in? Because so from a consumer standpoint on the issue of safety, what we're hearing sometimes is there's so many vaccines coming out. It isn't always just that one vaccine is safe, but is it really okay to have all of these vaccines all together? It's very overwhelming to keep track of so many, and there are so many new ones coming on. So on the safety messaging, there's a lot of work to be done with sort of the totality of what we're asking of patients, consumers, whatever word. The other thing, just super quickly, and I can go into more detail later if there's time, but one of the big projects we have been doing for over a decade is called Script Your Future. It's a national education campaign on medication adherence, and we've included vaccines and the evolving role of the pharmacist and the high level of trust, particularly in disenfranchised homeless populations that don't have a regular physician, let alone access to any kind of healthcare. And what we do, what we lovingly call a challenge, we work with all the pharmacy schools across the country, and they literally go into the local communities. And so there are different solutions. They've done community baby showers. They've done 3-minute clinics. They've done all kinds of work with faith-based and other community groups. And some of the takeaways that is not what you typically hear is many people, particularly those who don't have regular access to healthcare, and they're getting this information in a food distribution center because that's where you meet people, they relate, therefore they trust the students more. The students look like them, the students aren't threatening, the students aren't authority figures telling them to do something else that's inconvenient or almost impossible and out of reach. So I agree, no one messenger or way to reach people, but there really are some scalable solutions that are happening at the community level that are not overly expensive. It's a lot of people-to-people interaction.
Mm-hmm.
So I have a question that I'm going to ask next. This is not the order that they were sent in, but that's what I get paid for or don't get paid for. And this is, and any of you should, it's really aimed at the physicians, but Robin, you should certainly be able to join in because there are really actually two questions here that are related, which are, how do we depoliticize this is sort of the overarching depoliticize vaccines, because there is an ideological gap in the polling that we were presented with, but it's not clear to me why that is exactly. So the question, which I think is sort of this general question, how do we depoliticize vaccines and how do we start? But there was a particular question in this lot that I was very interested in, and that is as follows. Are there public health lessons we can learn from efforts to reach the hesitant, address their concerns, and avoid the ignore the anti-vax message? For example, in promoting smoking cessation, we learned that reaching out to people who wanted to quit smoking was much more productive than general messages about the benefits of not smoking. Now, as a television watcher in the evening news, I see this all the time. And I have to say, as a physician who's never smoked, I personally was very much more affected by the horrible pictures of people who are dying of all kinds of lung diseases and others than I have been about the don't smoke, don't smoke, don't smoke. And the interesting thing about this, which is going a little far afield, is we're seeing this battle going on in the vaping crusades against with young people being addicted to nicotine, and then on the other hand, being presented as a way of stopping smoking. So I don't really want to get into the vaping so much as because it's a whole separate topic, and we spend a whole hour on it. Maybe we will sometime, but I'm really interested in this question of how we can message this differently. What have we learned from messaging this differently? And this is not just a polling question. This is also a practicing physician, all of which you have been, the physicians on this have been practicing physicians at one time or another. This is a huge topic, but I thought I'd give everybody a shot at it and combine some of the questions that we have. So anybody can start, physician, pollster, or public advocate. Your choice.
I'll just say some of the literature and the research that we've been looking at shows that sometimes it's not the glitzy, many times it's not the glitzy, sexy, big messages that work. You know, Taylor, Beyonce, and Caitlin Clark are not going to fix this. It's more the mundane nudging, reminders, texting people, you're going to be at this clinic. Can we add on a vaccine? Just make it really easy, connect the dots for people, text in the language. They can make the decision, they're autonomous, it isn't a mandate. So there are some very functional steps that can be done, and the literature and the research are showing that that is more effective than, you know, big celebrities coming out and getting a vaccine in some stadium somewhere kind of a thing.
Yeah, Robin, that's a great point. So we want to just be presumptive and really create a culture of sort of assuming we're going to be doing vaccines today. And so almost considering looking at a vaccine care gap, like someone being due for a vaccine, as being like another vital sign you want to check at each office visit, and just normalizing. So like, hey, you're here today, you're due for your flu vaccine and your COVID shot. We'll do those before we're done today.
Right.
And just normalizing. So that's our culture.
And it's convenient.
And
People are there.
It's also not glamorous, and anyone can do it.
Right.
Yeah, I would just from the research, but the public opinion perspective, I do think there is you know, it's in some ways an unprecedented challenge. I mean, there's always been some, you know, doubt and lack of awareness or skepticism that's out there, but the degree to which this has become politicized, and we saw this in the data and saw this in our findings, I think reflects a need to find a way for people to sort of turn down the volume on, okay, I'm hearing this stuff from people that I politically support or I have some political identity with, but they're not really the ones who have, you know, who have good information on this topic. Like on this issue, on this topic, it's more my doctor that I trust, and that's people's initial inclination anyway. And what's been unfortunately discredited for many is more the broader institutions and the government agencies and so forth. And so is there a way to kind of, you know, turn down the volume of like, this is a political dispute, I have to pick a side, I have to listen to those who are, you know, my political leaders, and more, I have to listen to the person who knows me, who knows my, you know, knows my health, who understands what's best for my future, for my family's future, for, you know, for protection, and can reassure me about what, you know, is in their minds in the end. You know, the fear is, you know, there is something scary, there's something unsafe that they're worried about, and is there a way to sort of bridge that while turning down the volume of that? And I don't know the answer to it, I'm not offering one, but just saying that seems to be the nature of the issue we're facing with folks.
Dr. Briggs-Hagan or Dr. Branch, do you want to comment on this as also physicians who've maybe not recently, but have dealt with all this stuff?
Yeah, I do still see patients, pediatric patients in downtown Atlanta. So I get to experience a little bit of both the public health side and the patient interaction side. But I mean, I think what everybody's saying definitely resonates. Here at CDC, I think our goal is to make sure that vaccines are accessible, that they're available, that they're convenient, and that people recognize the benefit, that kind of risk-benefit ratio, but the benefits for them, and then ultimately to improve vaccine confidence so that people know that they're safe, effective, and and beneficial, so that that will increase demand that way. But it really does come down to those provider-patient interactions. I think, you know, it's not surprising that this was politicized. There was a lot of getting your health information through the media over the course of the pandemic in an unprecedented way. And, you know, over 1 million people in the US died during the pandemic. So it was an unprecedented response. But it, you know, prior to that, vaccines were, you know, the public health administered large vaccine programs to get them to state health departments, but really they were conversations between patients and providers. And so our goal in doing all of that is also, how do we collaborate with providers and provider organizations to give them the resources they need to make this easier and really have that patient interaction be easy so they can get the information they need to make the right decisions.
Yeah, I can agree with Melissa more. Like, I think as a practicing physician and as someone who, you know, helps to study and develop these vaccines, it came as a total surprise to both the medical and the scientific community that this would become as politicized as it did. Because prior to the pandemic, I would not have said that vaccines was a political issue. Healthcare in general shouldn't be a political issue. It should be completely apolitical. Who doesn't want to have good health, right? And what political party doesn't support the good health of their constituents? And so the fact that this became so politicized really took us by surprise, I think, in the medical and scientific community. And I think it had to do largely with it being a pandemic and the need to vaccinate 330 million people in the shortest time as possible. And so how do you get the message out? You use federal agencies. Unfortunately, federal agencies have political appointees. You use the media. The media, to some extent, is not as independent as we would wish it were or hope it could be. And so the messaging just really switched in this dramatic way over the last 4 years, that I think we weren't prepared for what the backlash of that would look like. And so I think we have to get back to the idea that while it's perfectly reasonable for news agencies to report on disease and vaccine developments, and it's perfectly reasonable for federal agencies and state agencies to be driving some of the work to get folks vaccinated and keep them healthy, this really has to be done at a grassroots, individual, physician to patient, pharmacist to patient, you know, community-based group level. And I think we have to do a better job in the United States of putting systems in place that really support that infrastructure. I had 1,000 conversations during the pandemic with 1,000 different people about vaccination of all different races, ethnicities, backgrounds, you know, social backgrounds, socioeconomic status, political parties. And, you know, and it, you know, yes, there were some trends, but at the end of the day, they really just want to know, how do these vaccines work? Are they safe? Why should I get it? And that's the conversation that people should be having, and that I think we didn't do as good a job because we couldn't during the last 4 years. But I think we need to just kind of flip the switch a little bit on that.
So I have two related questions to this subject. The first is for Robin. Some of those who push back on vaccine recommendations and mandates argue it's their business, and if you're vaccinated and vaccines worked, you shouldn't care what they do. What is missing in the argument about herd immunity is that gap in understanding how vaccines work to protect communities, harming outreach effects.
I think what's tricky is because we don't have very many national values that are completely aligned anymore. There's fractured different groups. I think that what we're finding is what an individual wants for him or herself and maybe their family is different than what they think about the communities. But if you look a little closer, it may be that someone in a rural, largely Republican part of town, there still are people that think it's a good idea individually to be vaccinated, but there's peer pressure from the community. So how do you offer a safe place to get the information and not be drowned out by sort of the echo chamber that some are in there? There needs to be a place where they can access the vaccines that they want. Some of what we're seeing is the use of peer navigators to help and patient navigators. but I think it goes back to, I think what Brian said, it is the messaging in those communities. If it's more about, a national security message that will get people vaccinated and roll up their sleeve, then use that message. You know, it's not going to be herd immunity, whatever it is that works, and testing them. And it also, the other thing I'll say super fast is it's obviously the messenger. I know the people in public health know this, but long ago in Texas, when they wanted first-time moms to use baby seats, no amount of data or local dialect or grandmother begging or anything worked. It wasn't until they lined up the baby seats, the infant car seat carriers, and the priest came and sprinkled holy water. Then there was 100% uptake, and the moms were convinced it was the right thing to do. Nothing else mattered. Nothing else worked. So we just have to find for each community and each individual what is going to resonate. It's really hard. It's really hard.
Well, this is another question about messaging, which this is up for anybody's, and that is vaccination a victim of its own success? That is, we don't have large numbers of children disabled or unable to breathe without assistance like we did in polio. I mean, I remember all that because I'm that old. The wrath of COVID was great, but it diminished quickly because of the success of vaccines and probably some quarantines as well. Treatments that limited the risk and damage from infection also, I think, changed the views of those who are considering vaccination but have concerns. So is that part of the complacency? Was we don't have the horrible epidemics that we had until we got COVID, and it only affected old people? And you know, we all have seen on television, or at least I certainly did, these sort of conversions of, oh my God, if I'd only known I would have gotten the vaccine. But it was kind of a little too late, and the politics had already been mixed into the crowd. I'd love to know any of your thinking about how we can change that in a way that somehow avoids the horrible political divide that this country is already experiencing.
I think we're probably all just going to say yes all at once about we are in this place in the wake of the success of vaccines. And so as a result, our patients actually only know the fear of, or the known reality of, maybe a side effect from having a vaccine. They don't actually still have a lived experience with things like polio, measles, congenital rubella, the list goes on. And so at some level, it's interesting that fear drives behavior for folks. And back in the polio days in like the 1950s, when those vaccines came out, it was the fear of kids getting polio that led people to line up in school buildings and almost like throw their kids at the needle to get the shots. Like, please give my kid the vaccine, right? We no longer really know that fear. And so we become complacent. I think there probably are some strides we could have, even as we're training medical professionals, about just even understanding the vaccine preventable illnesses that we're trying to actually eliminate or mitigate, I should say. Because the flip side of vaccine hesitancy for some folks is clinician confidence. The clinician doesn't actually know about why we want to give you the measles, mumps, rubella vaccine because they've never seen measles. There's no amount of like probably public health messaging about like, oh, there's an outbreak one state next door that's quite the same as that really robust lived experience of actually treating these patients. And so we don't want to scare people, use fear tactics. We probably do need to just elevate an awareness around like, what's the illness we're actually trying to prevent. There's good data when you talk about a vaccine and make a strong recommendation focused on illness prevention. People then actually are more willing to receive the vaccine. It's challenging, though, to not do that in a way that's a vaccine science lecture and isn't fear mongering. So there's going to be a bit of an art there as far as figuring out that messaging.
Yeah, I thought this was a great question, and it made me think about our success stories and do we celebrate them enough? I think the varicella vaccine the chickenpox vaccine hit a 25-year landmark just a couple of years ago. And so there was a lot of press that we tried to put out to acknowledge that, you know, even most people think of chickenpox as a mild disease, but it used to be 4 million cases, 10,000 hospitalizations, over 150 deaths in children each year. And in the 25 years that this vaccine has existed, we think that we've averted over 230 million hospitalizations, over 2,000 deaths, saved $20 billion. So those type of success stories are really there for each of these vaccines. And I agree, Dr. Brigham, that when you're giving this whole series of vaccines to your child in the office, it's hard sometimes to go through what each of these are doing, but it's important to say these are common causes of pneumonia, meningitis, and that we can prevent them today. So just to kind of.
HPV vaccine just like deserves a slow clap for the fact that we've driven down cervical cancer as the #1 cause of HPV related cancer and death. I mean, that's huge. And that's like within whatever it is, 15 to 20 years. Within a lifetime, within a career, we've seen a huge shift on HPV. That's a politicized topic as well, or it becomes a contentious vaccine for some parents. But just also want to give props to HPV vaccine.
And I do think it's a challenge to kind of build those stories. It's not just, it's, as noted earlier, it's not, information loses out to sort of, emotion and narrative and identity a lot, when people are trying to, weigh these decisions. And there is a narrative, like, as you noted, Governor Dean, there is we heard from some of the older folks, for instance, in our focus groups, that the narrative about polio and that they have vivid memories of, yeah, we had this horrible disease and it was scary, and then we had this seemingly miraculous change that made it possible to live free of that fear, and they could picture that and tell that story, and then, but they didn't have that for more recent. There's other success stories that have been happening all through these decades, and the narrative somehow has not taken hold in the same way. People haven't seen or experienced the fear in quite the same way of the disease itself, and that's a challenge, and even more so obviously in the sort of fractured media environment, the fractured trust environment that we have now, and makes, can there be a common story about here's something we are up against, we have to do to prevent what could be some terrible outcomes, and there is a need for some way for people to understand that in a compelling way in their own minds that probably goes beyond a set of numbers about it.
Anyone else on this? I've got a few more, but I thought we have a little less than 15 minutes left, and I wondered if anyone from the audience would like to ask a question. In order to do that, I think you can just use the chat room. And any of these folks would be happy to answer questions. I do have a few more, but I would like to check in with the audience first to see if they have some. Well, as they say from the podium, hearing none, hearing no objections. I have some pointed questions, but I think I'll skip them for now, lest they be assumed to be political. But I'll ask it without the pointedness and do my best. So we actually have a situation in one of the states where there's a significant measles outbreak, which brings up three questions. The third one I'm not going to ask because I don't want to be accused of being political. But the questions that I have are one, which is a variant on the discussion we had. A lot of parents had never seen measles because the uptake of MMR was so enormous, and now and measles is more serious than chickenpox in terms of the sequelae that can follow. So now that we see an outbreak, how do we deal with that? And again, not wishing to become political about where the outbreak is or what the medical profession has a responsibility to deal with. I'm just curious about what do you do? Because I don't want to particularly pick on a state, but this is not the only place that this has happened, where people in authority are saying don't bother, and the literally hospitalization and death rates are going up completely unnecessarily, because this is not an experimental problem anymore. I guess the broad question is a variation of what we already talked about, which is how is it that we as a society go back as best we can to the notion that we are all responsible for each other's children, and we're responsible for each other's grandparents, and we're all responsible together. I don't expect you to answer that question because nobody in the United States knows the answer to that yet. But, you know, particularly Dr. Bigham has had some very good suggestions on the ground, how to deal with someone who comes in to see you and how you deal with that. And actually all three doctors who, because you've practiced, have that. But what would you do if in an epidemic situation, which actually exists? Anybody should jump in on this because it's
Yeah, I can start with
No.
just what CDC is doing, if that's helpful. I mean, so we actually are in measles response mode as well. We have a center, a group of people across CDC that are dedicated to the measles response. And measles, first, I'd like to give the country credit. So vaccination rates for measles are over 90%. They're still 92% in kindergartners. You know, the lower rates are in the high 90s. So most people, independent of, you know, their affiliation, do vaccinate their children for measles. And most of the measles cases that we get in the country are imported when people travel, especially under-vaccinated people. But there are, of course, these pockets of under-vaccinated communities. And when measles hits those communities, you can have quite a large outbreak. So in the current response that's happened in Chicago, for instance, there's been a measles response where CDC and the Chicago Department of Public Health and Illinois Department of Public Health all worked together and really averted what could have been a very large outbreak amongst an under-vaccinated community by giving information and getting a lot of people vaccinated quickly and also practicing good isolation and quarantine practices. So for measles, look, we do know the tools, and when the tools are able to be applied and when the community accepts them, it's very effective at averting these measles outbreaks. So I just wanted to highlight those two things. I know there are, of course, challenges out there, but and sorry, the one other thing I would say is even with high vaccination rates, really for measles, because it's so transmissible, we need super high vaccination rates. So going back to getting all children vaccinated on time is really important and should not be political. It should be something every parent wants for their child.
Yeah, and I think just to piggyback on that, you know, I'm not going to assume that it's sort of a political divide necessarily. There's a lot of things that happened over the last 4 years that led to under vaccination rates in children and in adults. And so I think it has to be data driven. You know, why did the outbreak happen? What's going on within those specific communities? Why is there, you know, lower vaccination rates? Is it just because kids missed their series because of the pandemic? They weren't seeing their doctors. They weren't in school, so that they had these reminders to be vaccinated on schedule. So what happened on sort of a macro and also a micro level that led to the specific epidemic? And maybe some of that will be sort of vaccine hesitancy or anti-vax sentiment or politically motivated. You know, it's hard to know, but I think not assuming going into the situation, assuming that those are the drivers, I think is still quite important, because there are things that we can address easier than others. And so I think getting that data and really being vigilant within our communities and having the partnerships that the CDC does already have with the state and with the local communities are going to be critical.
So I do have one question from the audience so far, and that is, Dr. Bigham has suggested that fear drives behavior. Have we lost hope in the power of prevention? How do we get to a better understanding of proactive preparedness, having just come off the reactive fear of COVID? I think anybody can answer this, but it's particularly addressed to Dr. Bigham.
Yeah, I think, you know, this kind of echoes back to some of our opening remarks about cultivating trust and ensuring that folks actually have a soft landing place as far as a medical home. We have some major gains to make in this country around access to healthcare for everybody. I think that's a moral statement, not a political one. I'm hopeful I'm avoiding a political statement by saying that. And I think at some level, we want to make sure that we recognize the specific needs of the person. As we've talked this morning about vaccine hesitancy, one thing that maybe has been a theme in the background is like, it's as unique as the individual. And so there isn't going to be one response that's going to be adequate. It's actually going to be trying to like consider all the things for all the people, which is a big task. And I'm so grateful for the amazing work that we're seeing done at places like CDC. So thank you to my colleague, Dr. Briggs Hagan, for the work you're doing on measles and elsewhere. It's thankless work, often under the radar, but we couldn't do it without your guidance and your leadership. So thank you.
I would also just add that some of the ads from decades ago that looked at big societal issues are really informative. I mean, they're dated and there are problems with them in today's use, but some of the intent. So one example I always go back to is it was drug abuse, and they were interviewing families that said, well, I don't have kids in school, I don't have children, I don't need to worry about it. And then they turned to a yellow school bus. The bus driver was getting on the bus. She snorted some coke. She starts driving and she hits his car. It's everyone's problem. And it's trying to figure out how to make the message, it is about all of us together, and actually show, don't tell is always what we strive for. And I do think it might be instructive to look back in time at some of those messages from before. But and also we're doing a lot of work with Reed Tuxen on the Coalition for Trust in Health and Science, and there's almost 200 organizations. I think many of you guys are on part of that. Your organizations are part of that coalition, really looking at the issue of mis and disinformation and what to do about it. Because in preparing for today, I was looking at some of the research, and it is really unbelievably frightening where people go for information and who they look to as an expert. They listed everyone from God to all kinds of TikTok nonsense and everything in between, and it is quite alarming. So I agree, the work that the CDC and others are doing is vital.
It's very interesting you bring that up, because that's a specific, there is actually a exception carved out by multiple Congresses and health departments and everybody else for religious exemption.
Yeah.
There are religions, mostly very small, intense religions with fairly closed communities, which forbid vaccination. So but the greater question is not just what do you do about that group, it's what do you do when your identification as a human being is caught up in the notion that vaccination shouldn't happen, which then of course has an effect on the rest of the society. And how do we overcome? In other words, our society has been transformed by the internet and by social media. So now people are getting messages on social media that they never would have gotten before, which I think is part why the quote unquote anti-vaxxers have now created a significant impact in the society. But they've always been anti-vaxxers, and we've been historically willing to let them go. Now we can't, because there's such a significant portion of the population that public health has engendered, not to mention the health of their children. So we have a slightly different problem, although I wonder if there's something we can be learned in the past from our acceptance of the religious exemption for a relatively small number of intensely religious people. Nobody wants to bite on that one.
I think some of the data that was presented earlier was helpful in that regard, and this idea that what motivated people was protecting themselves and then protecting their immediate family, likely protecting kind of like their immediate community. So on the one hand, I think it's the national good is there, especially for things like measles, where you need very high vaccination rates, and to protect somebody who's got a low immune system or somebody that can't be vaccinated requires that the surrounding community is very vaccinated. But in that patient physician or pharmacist interaction, I think there does need to be clarity about what is the benefit, what is the safety of this, and going back to that at the individual level is going to be important, and answering questions that a person may have about that is still going to be important.
I think it's a noise problem. There's so much noise out there.
Right.
I just don't think we're putting out enough information. I mean, something that I feel really strongly about is, why do are people more willing to accept medicines than they are vaccines? Medicines are something you have to take every day. They're changing your chemistry. A vaccine actually just teaches your body to do something it does naturally anyways. And so where's that disconnect? And I think we need to just really think through a little bit how we're messaging, how these vaccines work, how they were developed, why this actually just leverages what your body knows to do already. And so I think we need to be noisier than the noise. That's my take home.
And
I
Dr.
couldn't agree more.
Well, I couldn't agree more is the last word because it's 12 o'clock. I really want to thank our fantastic panelists. This has been absolutely great. As a physician, I've learned a lot, and I really appreciate this. And we've got a long struggle ahead of us, but I really appreciate everything that you all are contributing. So let me thank you very, very much for participating in the fight against infectious diseases. And with that, I think we'll say goodbye. And thanks very much for our audience for tuning in. I hope you will go forth and spread the word.
Thank you.
Thank you.
Thanks, everyone.
Thanks.